Welcome, everybody. This is the NGO Forum on ADB session on civil society reflections on ADB's COVID-19 operations. My name is Ryan Hassan. I'm the Executive Director of NGO Forum on ADB, and I wish you a good morning, good afternoon, good evening, wherever you are. So one thing which needs to be said is this global pandemic of COVID-19 has probably united us as a human race, facing probably one of the biggest crises which has faced our time. And the response to mitigate it, to manage it, to deal with it and overcome it is going to be a collective response. In that spirit, we want to have this discussion around this panel today. So as all of you know, since 2019, this pandemic has gripped us since December of 2019, and it has cost us hundreds and thousands of lives. It has cost us billions of dollars in losses. And of course, it has taken a serious toll on people's mental health and physical health, exposing also our weaknesses in our development pathway, which is the frailty of the public health infrastructure system. So in that note, we've seen the ADB come up with a significant response in April. We have seen a $20 billion loan package entitled CARES, which is the COVID-19 Active Response Expenditure Support Program. So today what we're going to do is we're going to explore how this COVID-19 loans filter through the region and hear back from different country perspectives from civil society on the transparency, accountability, and efficacy of these loans. So from that perspective, we'll listen to stories from India, from Bangladesh, from the Philippines. We'll also have a comparative look at the World Bank COVID-19 loans program. And of course, we will be hearing from the ADB as well on their understanding of how the program is running and where are we moving collectively in overcoming this pandemic in the region. So I thank you all for joining us in this session. From the ADB side, I would like to introduce the Managing Director General, Woo Chong-um, whom we have known many, many years, who's interacted with us as civil society, to start off with the opening remarks. So Director Woo Chong-um, over to you, sir.
Thank you very much, Rehan, and also thank you for all the participants for organizing this very, very important event. And as you know, as Rehan says, I'm a friend of civil society organizations, and I think I consider civil society organization as my friends as well, because over the years of working in the development world, I find it really, really important for us to know what we're good at, but also what we are not so good at. And listening to people from different perspectives is a crucial part of making sure that we know what we're doing in the future. And in particular, when we speak to the civil society organizations, we often are able to find our blind spots. So I take this as a very, very important opportunity. So in terms of our COVID-19 activity, it's still working under the strategy 2030, where we are mandated to scale up our collaboration with all our partners and in a much more integrated way. So this actually gave us a very, very good opportunity to demonstrate to our stakeholders that we can work as one, not just within ADB, but with outside ADB partners as well. So in the last 12, 13 months, in my memory, I don't think we've done better than what we've done in the past 12 months in terms of collaborating with others. So we hope we can continue. So when this whole COVID-19 hit the world, it also took us by surprise, both in terms of our operations as well as the way we work. And I still remember around the middle of March, we went into lockdown, and I naively thought at that time maybe it would be for a couple of weeks, and then we'll come back to the office. But we are still mostly working remotely. I'm actually one of the few people who's coming into the office together with Mr. President Asakawa. So when this pandemic hit, initially ADB thought about what's the most effective way of helping the developing countries. And at that time, as you know, March, April, the infection was going crazy and people were not able to get access to the personal protection equipment and medical supplies. So we did something unusual. We created a very, very massive technical assistance program to provide quick dispersing assistance to the developing countries so that they can procure badly needed this equipment so that we can help flatten the curve. We haven't heard that expression for a few months now, so it was all about flattening the curve about a year ago. And then the next phase was, as Rayan mentioned, that $20 billion program for developing countries so that we can provide them support in terms of budget support for social protection and socioeconomic support. And then, that's what CARE and other programs are all about. And then a lot of developing countries sought support from ADB in accessing that facility. But in the past 5-6 months, it's all been about the next phase, which is providing effective and safe vaccines for our developing countries. So under the AP Asia Pacific Vaccine for Support Facility, we have $9 billion, as you know, to provide developing countries needed financing to procure and deploy safe and effective vaccine. And this is where we have to work very closely with all our development partners, such as the WHO, COVAX, CDC, UNICEF, and others, so that we can crowd in the knowledge. Because, as you know, we are not the sort of health organization with lots of technical expertise. So we are relying on the health agencies in terms of their health knowledge so that we can leverage the latest developments of the vaccine industry. So we are in the middle of implementing the APVAX facility, and Indonesia and the Philippines were the first two countries to borrow the resources from here. And at the same time, we are working with a lot of other partners so that we can actually identify the available vaccines for our developing countries. So we hope that we can be successful in deploying the vaccines as soon as possible. So let me pause here, and then I'll be looking forward to listening to the colleagues from other panel members from different perspectives on the work we've been doing so far. Thank you.
Thank you, Director General. And I think you alluded to some very important points in terms of the loans themselves, and it's good to hear about the $9 billion vaccine loan package. I think the questions which will surface is, considering the economic toll it is taking on the borrowers, these loans too will be a burden unless they're used effectively. So the next session, I will hand over to my colleague, Ms. Nadine Matkour. Nadine Matkour is the Safeguards Policy Analyst of NGO Forum on ADB, and she's been looking at the World Bank COVID-19 loans and will share some civil society perspectives on some of the criticisms and some of the angles through which we're looking at. Nadine, over to you.
Thanks, Ryan. It's really a pleasure to be here today to speak about my research, and particularly on how the World Bank's loans on COVID-19 has been propping up external finance debt for many developing countries. So as my colleague Ryan alluded earlier, COVID-19 has exposed how a widespread failure to invest in strong and universal public health systems can dramatically widen health inequalities. We are really witnessing these failures in India at the moment. Which is ironic as well, because the World Bank's president, David Malpass, dubbed it the inequality pandemic, considering their contradictory history in pushing for privatization of the health system in the global south since the 80s. What the pandemic exposed in particular is how low and middle income countries have seen their public finances hollow out as a result of external financing debt, conditionalities, and austerity. Today, it is these same nations which continue to battle the virus on so many levels. And in these countries, the lack of free and quality healthcare for all is affecting the poorest people most, or going without testing, treatment. What we are also noticing is, in many cases, the development banks have been using their funds as part of the COVID-19 recovery to prop up infrastructure projects, which begs the question, are those really necessary in this current time? Next slide, please. So in March 2020, some colleagues and I here in Australia began seeing the so-called COVID-19 loans given out by multilateral development banks, many of them World Bank and Asian development banks. With bilateral aid drying up at that time as well, funding from multilateral development banks, or MDBs, became a vital venue of that COVID-19 pandemic. So we focused on World Bank, particularly because their policy and project directions are influential in establishing development directions in the past. I'm not going to go into an extensive history of the World Bank and their efforts in healthcare, but our research has shown that the World Bank has adopted very limited approach on healthcare and public health in particular when it came to funding it, and their efforts have been primarily focused on enabling the private sector operation in healthcare. But as the private sector burgeoned in healthcare, so did out-of-pocket expenses, so did user fees, which impacted people living in extreme poverty the most. Next slide, please. So in our research, we reviewed the Fast Track Facility, or the COVID-19 Strategic Preparedness and Response Program, also known as SPRP. We've reviewed 71 of these loans, and particularly their project documents, which were available as of July 2020. We focused on Indonesia and Sri Lanka as our primary case studies to analyze the differences in response approach and assess whether the first phase of these World Bank COVID-19 funding does enough to actually support the universal healthcare goal of the Sustainable Development Goals of the United Nations. This was part of a global effort, obviously done by a number of organizations, and I'm sure my colleagues later will talk about their work during this session. So our analysis focused on content particularly related to keywords such as prevention, free healthcare, user fees, and private sector involvement in these project documents. What our review showed was that the World Bank's response to COVID-19 has missed vital opportunities to actually strengthen public health systems in Indonesia and Sri Lanka, which is an essential step to realize the Sustainable Development Goal 3, good health and well-being, and in particular target 3.8, achieve universal health coverage and access to safe, effective, quality, and affordable essential medicines and vaccines for all. What our research showed was that while the World Bank's response has been strong, for example, in disease prevention, including increasing testing capacities, PPE, and personal training for healthcare workers, it really lagged on basically trying to maintain a quality access to healthcare. So in terms of those projects we've assessed, we've only seen 8 out of 71 World Bank projects actually include any plans to remove financial barriers such as health user fees and out-of-pocket health expenditure. This obviously posits a huge hindrance to many people, again, who are living in extreme poverty, people who are being refused beds every day in public hospitals because of overreach and oversurged capacities, people who have no access to either preventative measures or treatment facilities. Next slide, please. So the MDBs, such as the World Bank, have historically used their policy lending to disseminate these austere restructuring measures and privatization, specifically of the public system, which is the only available system serving the poor. This is certainly in the backdrop of the Beyond Aid, which has been pushed by the World Bank, the announcement of the Maximizing Finance for Development approach, which focused on leveraging the private sector and private financing in development through public-private partnerships, or PPPs. We're also seeing similar trends in the Asian development banks. So creating investable opportunities for the private sector has been one of the main architecture of this approach. But what this approach really neglects is how this creates environments where profits are privatized, but losses are socialized. So we found in our research, for example, that privatization of healthcare system have extended outbreaks such as the West African Ebola virus, the Zika virus, and now we're seeing similar trends with the current COVID-19 crisis. In fact, the independent evaluation group of the World Bank found in its latest evaluation that PPPs have worsened access to healthcare. They are actually also a more expensive way for governments to invest in health-related infrastructure. So my question is, why are multilateral development banks furthering this approach? Next slide, please. So this turns me to my major question, which I'd like to address in the next couple of minutes. Are private actors serving public interest? Achieving equitable healthcare for all relies on investment in strong and accountable universal public health systems. I cannot stress this enough. While the private sector can play an important role in tackling the COVID-19 crisis, especially when it has the lion's share of intensive care facilities and large numbers of trained health workers, it also brings with it a significant challenge and risk. The private sector is privatizing profit before patients' needs and rights. We saw Spain and Ireland, for example, recognizing the shortcomings and taking a radical approach to the crisis by nationalizing their whole private hospital sector to better understand capacity and personnel limitations. But more important, there are really structural problems in how multilateral development banks choose to engage with the private sector. From our review of the project documents, we noticed that there's absolutely no clarity or level of detail on what is going on, essentially between private sector development banks and government. So we end up with projects that go beyond what was on and allow for no scrutiny. There's also very little due diligence on environmental and social assessment as part of the safeguards policy that is being upheld by these multilateral development banks. This, of course, undermines the public health system, strengthening commitment made by the multilateral development banks. So the research conducted on the ADB shows similar shortcomings. So it is really imperative that the ADB strives to ensure a more transparent and accountable role in international development, which is for development, not on development. Next slide, please. It's really time for an urgent redirection. I want to remind the World Bank and the ADB that their projects have contributed to the increasing vulnerability of people in developing countries, and in many cases, the physically and socially displaced people from their livelihoods and their homes. These are the same people who are not awarded the luxury of social distancing and quarantining because they work for a daily wage, and no working means no food. The pandemic has exacerbated gender inequality, and women living in poverty have borne the brunt of the pandemic. The World Bank have underlined how a weak public system have killed more people than the disease would have during the Ebola outbreak. Today, we are witnessing how disruptions to the healthcare system have claimed more lives, which could have been prevented. So there is an overwhelming research really showing to how a strong public system can be more adept at handling health crisis. So again, why is this evidence being dismissed? Next slide, please. So this is just to essentially reiterate the point I'm trying to make, that these are the realities currently facing the public system in developing countries. Next slide, please. To this end, we are really urging the ADB and the World Bank to diverge from the World Bank is doing, to end user fees and direct payments for all essential healthcare, to introduce minimum standards and safeguards for any financial support provided to the private health sector, to ensure full inclusion of civil society and healthcare union stakeholders at the local and national level in the design and implementation of healthcare projects, including women's rights organizations, and to also ensure that the health sector is not anti-poor and adjusted for the wider rural-urban divide. Thank you so much.
Thank you. Thank you, Nadine. I think you touched upon some very important points, which is the PPP model, the overemphasis on private sector and the health sector, and how that has shaped the response. I personally have suffered deep loss with COVID-19, with my mother-in-law passing away, and it boiled down to overcapacitated hospitals and not enough ICU beds. And I'm sure these kinds of stories are common now in everyone's families, and no more so than it is in India. So I would go to Ms. Vidya Dinkar, who's the president of the Indian Social Action Forum, who's deep inside India's current, I guess it's the epicenter of the pandemic right now globally. So Vidya, first of all, I don't know how you're surviving. from what we are reading in the newspapers, but it would be great to hear your take on the CARES program and broadly, how is India managing the pandemic? Vidya.
Thank you, Ryan. We all know that it's a very difficult time for all of us in India. But I think we need to evaluate and say this out for everyone to understand also, and therefore I'm here. So right now, COVID-19 is a crushing personal catastrophe for most of us in India. In fact, every single person I know has been deeply affected by the virus and its play across India, either impacted directly or has someone very close to them pushed into a kind of calamitous situation. We have all seen the images. You have read the reports. You've actually felt the pain of patients and their loved ones as they are rushed around on stretchers from hospital to hospital, gasping for air, only to be turned away. It's a desperate, subhuman kind of situation. The critically ill are on the floor, on corridors, in hospital parking lots. Some get lucky enough to even share hospital beds or get breathing time on shared oxygen tasks, but not everyone is as lucky. And with over 350,000 cases recorded every day, and death literally stalking us everywhere. Bereavements in rural areas not even being recorded as COVID-related deaths because testing is even more limited there than in urban areas. So we have an official figure of a cumulative national death toll of 222,408 from COVID. And literally as a country, we are racing against time, pleading for oxygen, for beds, medication, and really buckling under the pressure of the pandemic. There is no dignity in death, too. Space and burial grounds and crematoriums are just not available. There's no time to mourn. Even as children are left orphaned and families cope with both death and debt, personal debt that they have run up through this crisis. Healthcare and sanitary workers are left to fight an impossible battle. And the stench of fear and death is everywhere. The state is trying to cope, but everyone is questioning their misplaced priorities. There is this grand new parliament building and whole complex that is being built at potloads of money. There are elections that just ran their whole course in 5 states. There are big religious gatherings that continued. Even as our leadership tried to say that, from even as late as February and March, our leadership was saying that we had conquered COVID and we had done so well. Well, a year into this devastating pandemic, we know that it's again the most vulnerable who are being hit the hardest. We all collectively feel let down and let down very badly. Wave 1 last year had our urban poor, the working class, suffer the indignity of begging for food because our government's response to the pandemic came in the form of curfews and extremely tight lockdown that was clamped within 4 hours, not giving enough response time, and really with piddling relief and stimulus packages. The government's move to put 1.3 billion people in lockdown for 21 days, extended by another 21 days to contain the outbreak, was really might have been in line with government responses across the globe, but in India, it hit the informal sector and the poor very, very hard. Almost 80 to 90% of the informal sector, and they were dealt a death blow in April 2020. But that was when the Asian Development Bank, the ADB, came in like a knight in shining armor. It was April 2020, and they came in to save us from poverty, starvation, ill health. They talked of access to immediate health care for all and economic relief for vulnerable groups during the COVID-19 pandemic. The COVID-19 Active Response and Expenditure Support CARES program was intended to support the government's implementation of the emergency response launched in March 2020, and even was so generous as to offer to help us with even past expenditure under these relief measures. So, in fact, in the first 69, 70 days of the lockdown period, India had loans flowing into the country to the tune of 3.26 billion USD. 2.5 billion of that came in during the first and second lockdown itself. This is from government data. The question to ponder here is, did it allow India the luxury of a continued lockdown? But when we look at how the poor have experienced that first lockdown, we see that that luxury was only for the government, and now we understand that there wasn't even a pandemic preparedness plan in place. Otherwise, our health system would not be in the shambles that it is in. The 1.5 billion, I must say, was super efficiently delivered by the ADB. It was approved and delivered immediately, all good. But since then, there's been like deafening silence. No financial reports that we see, no monitoring reports online with the ADB. And we wonder that even if it is money paid out during an emergency situation, there needs to be more put in. To follow the money trail, we filed what we call the Right to Information applications under the Right to Information Act of the country with the Department of Economic Affairs, which is under the Ministry of Finance, and various line departments and ministries, the Ministry of Health and Family Welfare, the Ministry of Rural Development, the Department of Agriculture, Cooperation, Farmers Welfare, Ministry of Consumer Affairs, Food and Public Distribution, etc. But there was very limited information forthcoming as to how the 1.5 billion USD that was given in as a loan by the ADB was actually utilized by these executing stakeholders, which makes us conclude that there's been a complete lack of transparency, and worryingly so. Citizens are in the dark. So they could not sort of keep an oversight as to what the government was doing with all the money that had flowed in. There is no clear utilization data of the loan amounts available to us, either from the Ministry of Finance or from the executing agencies. The poor or no information disclosure makes misuse and disuse possible, and an emergency situation is no excuse to not rein in crucial omissions and commissions of borrowing governments. No monitoring reports in the public domain from the bank. Has even early this morning, I checked, reports we accessed through government RTI were of very, very poor quality, and laughable, because they were just a compilation of press information bureau bulletins and media articles that really any average citizen could have put together for the government. A no report card means we don't know how this could have got better. There's a co-financier. The AIIB put in 750 billion into the same, but they point to the lead financier when it comes to monitoring. And of course, the lead financier, ADB, has been totally inadequate on that. So we are in a situation where medical infrastructure has not been created. The poor are left to fend on their own. Ordinary people, same. And it could have, and the money is paid out, could have had a more significant impact had there been tighter controls over the lending parameters, holding the government accountable for what it had received these loans for. And perhaps that could have ensured better on-ground implementation and saved us from the terrible, terrible situations staring us in the face today. Considering that we walked blindly into a tsunami, not a wave two, thinking that we would have learned some lessons from wave one, what we have learned from our research and investigations is that we dropped the ball early on, and no monitoring by agencies that were giving us this money has meant that there are gaping holes in the cracks that were already in place. We know that the number of poor has more than doubled. Some figures, the World Bank data says from 60 million to 134 million in just a year due to the pandemic-induced recession. This has meant that India has been pushed back into a situation that some call a country of mass poverty after 45 years. Really, we need a report card as to what the money has contributed to, how it has helped, and is the ADB willing to learn from its lack of monitoring until now? Yes.
Thank you, Vidya, for that very critical and honest reflection of what's happening in India. And also, you alluded to the ADB loans themselves and the lack of transparency that everybody has been facing in trying to dig up how the money was actually spent. I'll take this time now to take some questions, and I see that there is one particular question which has come in through the pigeonhole, and I'll point that to Director Woo Chung-um. I'll just read it out. I think it's from Professor Suzanne Engel, who's a friend for all of us. So sorry to hear of people's losses. I've been reading documents on ADB loans, bailing out the private sector healthcare providers in India during COVID. They include no requirement to treat the poor. ADB, could this be? So that's quite a pointed question towards, are the loans directly going to the private sector? And is the public health need been addressed? And how is ADB actually monitoring these loans from the borrowers? So Director Buchung.
Thank you very much for these two speakers who gave a very vivid account of what's going on in some of the places here. And I can relate to a lot of the points being mentioned, because when you look at a lot of these reports that's coming out, it's very unfortunate that in many countries are experiencing basically zero growth for the first time in many decades. And what we're trying to do, everything we can to try to make that a temporary thing and not to have a permanent rollback of economic development progress that's been made by a lot of these countries. And even before this COVID-19, this health issue became much more acutely important for us, for ADB. It's always been important, but as you know, in strategy 2020, 10 years ago, the health sector was not highlighted as one of the priority areas. So we focused on infrastructure, finance, and education, and so forth. But over the last 3 years or so, the importance of the universal health coverage have become very clearly important. And also during the Japan leadership of G20, this agenda, universal health coverage, has become very important for us, and so that's why it's been reflected into our new strategy 2030. And as you know, we have 7 priority areas, and one of the very first one, addressing remaining poverty, focuses on human development, and that basically means health and education and social protection. And on the health sector, we're in the process of sort of rebuilding our knowledge also, because we've because of the sort of not focusing on it too much over the last several years before. We are building our internal knowledge, but this is giving us, again, as I mentioned, the opportunity to work with other partners. So this is taking time, and this timing of this COVID-19 hit just as we are starting to sort of scale up our operations. So under strategy, the impact of this strategy 2030 work in health sector, we probably are not seeing the impact yet, so that will take some time. But as in a way, this pandemic has really pushed us very hard to look at every possible way of enhancing our effectiveness in working with the governments to build a public sector health service, but also private sector. I mean, that's something that we don't want to rely solely on private sector, but like in any other sectors, private sector can play a very important role in terms of leveraging finance as well as knowledge, and they can move really quickly. For example, last year when we I mean, this is not about ADB's work, but when Philippines, we are struggling to get the testing, like PCR testing kits available. And like a year ago, it used to take 3 to 4 weeks for any testing results come back. But the private sector was mobilized, and that quickly changed, and now testing is not an issue. So, we are hoping that we can achieve similarly important progress by mobilizing private sector. The other comment about the reporting, everything we do, the reporting and monitoring is such an important part of our operation. So our board of directors will not approve anything, and our management will not approve anything without having proper monitoring. So, for example, on the CARES on the Indonesia, Philippines, and Cambodia, I know it's been publicly disclosed. So in the case of India, if there's an issue, perhaps if you can send me the information that you have, and I can directly discuss with colleagues working in India program to get you the answers. So I'm pretty surprised to hear that there's not enough information out there that you can access. And again, we are in for the long run, and we hope that we can work with both public and private sector so that we can put an end to this pandemic as soon as possible, but also be ready for future, because the health security issue is one of the agenda items under our health program. And we are actually hoping to build the capacity of the developing countries so that they can be ready for such pandemic. But this COVID-19 came a bit too early. But we are learning quite rapidly now. So we hope we can make a bigger impact for the developing countries in the future. Thank you.
Thank you, Director Wusongum. Well, one thing is for certain, listening to the WHO and the Bill and Melinda Gates Foundation, that this is not going to be the only pandemic. And we are going to look at more zoonotic viruses propping up in the future. So 54th year of the ADB. So it's a 50-year-old bank which hasn't looked at the public health sector for a very, very long time. And it's not only the ADB to be criticized, it's also the governments who have led a development model which has not looked at access of local communities. And this is where we are right now as to what happens when you're not looking at the right thing. So hopefully we can reorient the ship in time, in order that the ship doesn't sink. So in that spirit, I'll move on to my own country. I'll go to Mohammad Zakir Hussain, Honorary Executive Director of Change Initiative and member of the Bangladesh Working Group on External Debt. If you can walk us through what is the CARES program like in Bangladesh? Zakir.
Thank you very much, Ryan, and the other distinguished speakers, and DG from the ADB, Mr. Uchong, and my colleagues are here, and the listeners who are just joining us through the social pages and others. Good afternoon, good morning, and good evening from my side. I think my colleague has already given some snapshots on what's going on in terms of the utilization of the COVID-19 related debt financing in the country specifically, as well as the global, some other case stories on specific countries. But I would like to just reflect on the COVID-19 related financing, external financings, how it's going on and what is the current state, and what should be done for just proper utilization of the funding, especially whenever it comes to the universal health coverage and other issues as there. So next slide, please. What I would like to say that whatever it starts, that the first wave of the COVID-19 Bangladesh, it was back in March in 2020. And that was the first level of effects. But right now, the second level wave is going on, and it is a little bit deadlier than the earlier compared to the earlier one. And from the 14th April to the 21st April, it was record 600 people died due to the this COVID-19, but not necessarily as much as the costlier like the India versus going on right now. But what is really interesting that earlier there was it was almost 1 year has passed that the people faced a serious crisis in not only in just accessing the test capacity as well as, but also some sort of shortage of the oxygen and the ICU beds. But what we have seen in that when the second wave is going on, there was also the shortage of the ICU beds and the high flow oxygen supply. So question comes, what is the real learning in the last 1 year, and how the money especially has been spent for what purpose? Because ADB has already project titled the COVID-19 Response Emergency Assistance for the need to increase the health sector's capacity. So this is then questions comes to whether ADB actually properly assess the feasibility or the requirements for the immediate requirements of the health sector, especially public health sectors, to respond to the COVID-19 properly. So next slide, please. And another project as ADB has provided the funding, that is a COVID-19 active response and expenditure support program, and just for the economically vulnerable community, especially who are the most vulnerable due to the COVID-19. Almost more than 70% people in the informal sector have lost their jobs, and some people have been compelled to just send back their family to the rural area from the capital city Dhaka, and as well as there is a huge crisis, because the one thing is that in last 50 years we had a progress to reduce the poverty rate by almost 50%. Unfortunately, in 2016, the poverty rate was around 24%. That has been already been pushed up in the around 41%. So this is fundamental challenge to achieve the SDG and the no zero poverty or something like that. And the thing is that overall, since March, what the government is trying to since March 22 to just address within its own limited resources as well as the external financing. But unfortunately, the recent data shows that only around only around 30% of the whole commitment from the external financing, especially ADB, World Bank, IMF, and AIB, has been disbursed. So that though that was an emergency response, but unfortunately that is not coming as expected earlier. So next slide, please. So this is the overall funding. Almost altogether $3.4 billion have been promised by the four ADB, World Bank, AIB, and IMF on the COVID-19 response. But only from ADB it is around $1 billion, and ADB along with the AIB is among them the $500 million have been just dedicated for the COVID-19 response. Next slide, please. So what we have seen the COVID-19, the first project I have referred earlier, that COVID-19 response emergency assistance projects, it was $100 million projects. But what we have seen that $79 million already has been allocated for the project in the current fiscal year. And the objective was 50 beds isolation center in each of the 7 government medical hospital, medical center, and health sector, and other sport lands of this country would be set up. And the second objective was that to set up the 10 extra ICU beds each in the 17 government medical colleges, as well as the project also includes setting up transmission of the LARS and other in the 4,492 Bujela health complex. Next slide, please. But current situation is not very much appreciable, because till now less than $900K has been spent under these projects, and none of the facilities are established. And also the machines, the PCR machines are supposed to procure more than 100 PCR machines, but only 1/4 has been purchased. Next slide, please. Next slide. So other projects are there, COVID-19 emergency response related project, technical assistance project, additional financing to help and even the pipelines. There was also the commitment that $940 million credit should be provided for the vaccine purpose. Next slide, please. And that is the second project I referred, but that for the economically vulnerable, to support the economically vulnerable poor people, and that is. But what we have seen that the progress is not so far. Next slide, please. That the objective lack of transparency in the implementation of this the support program has been already reported by Transparency International Bangladesh, and also there is a delay in providing the funds, as well as the allegation of the erosion of the integrity in terms of the fund allocation, especially by against the local government representatives. And in the second objective was to just support for the RMG workers, but RMG workers is on track. They are claiming on track, but RMG owners commented that they will need additional funding, and this is on sort of issue that is not expected. And also, the only 54% allocation estimate have been disbursed, which are really, from equity perspective, it is very much unfortunate because their support for the agriculture is lacking as well. Next slide, please. And this is what we have seen, the transparency. In terms of the transparency, we requested to the ADB local offices just to the checklist on the specific questions about the accountability and transparency issue have been raised. But unfortunately, that was I was advised to just go through only the project proposals and other document. They did not yet respond any sort of responses on the issue of the procurement-related corruption and other issues. So that is also important from the ADB perspective to be more accountable. Next slide, please. So why accountability matters? That in every stage, some of the snapshot I have given that how people are really suffering, so because due to the delay in disbursement and humanitarian crisis has been emerged, and 91% reported they don't have enough money for buying foods. Lack of monitoring, ADB's monitoring implementation is weak because they totally rely on the national system for the monitoring purpose. In terms of the process monitoring is really important, and that's why we're telling about that whole of governance approach is really important. Everyone, governments, society, community, everyone should bring together. And lack of safeguard against corruption. This is fundamental issues for the future learning. Next slide, please. So this is the figure that have shown that in respect to the 1970. So there is no much more progress in terms of the access to the healthcare capacity, and the Bangladesh is the lowest among the South Asian countries. Next slide, please. And this is also the per capita expenditure percentile of GDP has been going not even going down, but recently they have that in push, but that is not much more. And all, but on the other hand, the out of public private expenditure is going up. That means the private sector's intervention is going up, and people have to pay more for their access to the universal health coverage or access to the health facilities. Next slide, please. Sorry for taking much more time. And so what is very important, how the mutual accountability matters, because the former chief economist, the World Bank, and also the leading economist, he has already told that there are lots of instances of the debt not having proper utilization, misuse of the debt, and also this is the time for the to reduce the external debt burden, because it has been already around 40% of the GDP, and the debt system depends on the effective utilization of the projects and money as well. So debt finances. But what we have seen that projects are often designed with the proper planning, and this, and also there are some sort of quality design has been reported in the development policy proposals, and also the lengthy approval process are also very much challenging for that. And releasing funds with the setting the procurement debt bottlenecks. This is fundamentally challenging for the local level the proper utilization of the funds, and that we have seen that the lots of people have been suffering due to shortage of the oxygen as well as ICU beds. So finally, the final slides is that next slide. So the way forward is that the fund requirements, especially for the health sector, should be around 5% of the GDP, because otherwise the universal health coverage for the through public health facility will not be achievable. So next point, please. And independent assessment as well as citizen monitoring would be the integral part of any external funding, and the ADB should focus on how that should be mandatory for the within the public procurement process. Next slide, please. Next one, and the new global deal is required, and that is which we are talking about the Green Deal, and that should be meaningful account to both the ADB supply and demand side of the external debt is required, and not only post-audit but also the process monitoring is required, because that's the proactiveness from the MDBs like ADB and other, that they should have some sort of engaging the third-party independent monitoring during the whole procurement process. Otherwise, it would not be useful just putting money in the hole. That is really concern for the, especially to set the standards for, and because this is the life matters, not only money matters, because whenever it comes to the COVID-19 pandemic, that we are observing that the India situation, because every time the money doesn't matter, but also to design the project such a way so that that is the best thing for doing is the community.
I have to wrap it up because we have other
sorry for
speakers.
that. Thank you very much.
Thank you. Now, I think you made some very, very critical points, and I think a detailed report will also be going from Bangladesh to the ADB. And on the responses which we did not get from the resident mission, I believe we can ask Director Wu Chong to help us out to get a bit more response on the information disclosure. Thank you, Zakir Bhai. I'll quickly move to Professor Rene of Renea. Professor Emeritus, President, Freedom from Debt Coalition, to walk us through the Philippine scenario. Sir.
Hello, good afternoon, everyone. Hello? Okay. Well, I'll try to be quick. When Ryan included me into this panel, I asked him if I should raise questions. And he told me, you should share your reflections. So I've been doing some researches on ADB and its role in the development scenario in Asia Pacific. And you see, ADB's publication, they keep saying ADB is a bank committed to achieving a prosperous, inclusive, resilient, and sustainable Asia and the Pacific. I like that. But the problem is, how is ADB translating this? I believe this slogan or whatever goal was formulated by ADB, partly inspired by two UN agreements. One that happened in 2015. You have the Paris Agreement limiting, trying to ask different countries to limit the collective emission of GSC so that global warming cannot be more than 1.5 degrees Celsius. You know all of that. And then the second one is in 2015, you have the special Sustainable Development Goals, which replace the Millennium Development Goals. Now, I have to thank ADB for the different documents it has published in relation to this, especially on climate change. I must confess that I learned a lot about the threat of climate change to humanity from my reading of ADB materials. But ADB is an enigma to me and to a number of civil society organizations because while it comes up with very good materials explaining the threat to humanity, to planet Earth of climate change, is not able to come up with a resolute position on how to and to phase out the fossil fuel, coal, oil, and gas, and how to phase in the renewables. It is an enigma because you see everywhere there are many experiments and projects of ADB supporting renewables. But at the same time, yesterday the president of ADB only said that we stop funding coal. But there's no position on how to phase out existing coal projects. There's no position on how to stop funding for oil and of course natural gas. It's not able to do as to do what the European Investment Bank did last February. You see, European Investment Bank said no more coal, no more oil, and then last February they said also no more on natural gas because natural gas is a source of methane, which turned out per study of scientists to be even a worse uh, contributor to global warming compared to the emission of coal. So, and it's the same message made by John Kerry uh, last February in his message to a group of of power producers in America. So, why can't ADB make such a stand? Given its studies and its position, I realize it's because of ADB has a long history in Asia of funding power projects, infrastructure projects, and of course, naturally, in these projects, you have the involvement of Japanese corporations, Japanese engineering firms, and of course, participation of different corporations uh, around the world and usually under the term called by ADB as co-financing. So hopefully ADB one day can be more resolute on this, probably this year. Now another issue is on SDGs, Sustainable Development Goals. When it comes to SDGs, ADB doesn't have much materials, probably is relying a little bit on the UN development program based in Bangkok and Colombo. And also, you have in Bangkok, you have this economic social commission, Economic Social Commission for Asia Pacific, which has been producing a lot of documents on SDGs, saying in 2019 that Asia is on track not to meet, but to all the targets for SDGs. You see, you have this target by 2030 for zero hunger, zero poverty, good health and well-being, quality education, gender equality, and so on. And so, and then with COVID, it's even worse. Now, but you see, you have this SDGs, and ADB embraced it. So the question in my mind is, has ADB embraced the SDGs fully, or is it just making a rhetorical stand? So, especially in relation to its intervention on COVID. And so, uh, when I try to examine this project CARES, you see, uh, CARES started with an initial fund of $6.5 billion. Immediately, it was increased to $20 billion. It was already mentioned by our colleagues, but take note: the first three countries that received I think $1.5 billion each. The first three beneficiaries of CARES: Philippines, Indonesia, and India. Now look where are these countries now. These three countries have the most number of infections, and they have the worst performer in relation to the management of the epidemic. And I was surprised that there seems to be some pattern in the performance of these three countries. First of all, these three countries were very dismissive of the pandemic at the beginning, and most of them acted only in March and April, 3 months after Wuhan virus was exposed. And then secondly, the first reaction of these three countries is to impose a very strict militaristic lockdown, as if this is all a question of locking down people, shutting down businesses, and so on. And then after this, but by locking down countries, they forgot to arrange or organize the medical response. It seems that this is the uniform pattern also. In the case of the Philippines, it was very chaotic. March, April, May, June, and the dashboard was set up only in the second half of the year. And up to now, uh, we cannot say that we have a reliable monitoring and tracing and of infection. And then after that, when there was a slowdown in the spread of virus, you have a relaxation by by the leadership of these three countries, and then it was followed by a surge, as what we are seeing now in very unfortunate uh, in the case especially of India. In the Philippines, we have this surge in March, April, and so we have now this militaristic lockdown. But I think Arundhati Roy, this famous Indian novelist, was correct. What's happening in India and in other countries is a crime against humanity, and it's very, very sad. And then now with the surge of with this surge in virus again, so now everybody, almost everyone uh, in Asia, talking about how to procure the needed vaccines. Then all of a sudden we're confronted with this problem of vaccine nationalism. The how to procure vaccines that seems to be monopolized by a few pharma companies around the world. So, in the case of the Philippines, I think we can hope for a so-called herd immunity, probably middle of next year. So that means last year was Annus Horribilis. This year another Annus Horribilis, and probably also next year. And that also applies to many countries. Now, how come it was so easy for ADB to release this? You see, this CARES program was, I think, was crafted in March and April, and within the month of April, it was immediate. Most of the countries asking for loans were given. It was quick compared to the behavior of ADB in 1997-98 when there was this Asian financial crisis. I think the reason for that was in 1997-98, the mantra of the International Monetary Fund, from where the ADB gets a signal, was austerity. Austerity. And you should recall the quarrel between Prime Minister Mahathir of Malaysia and IMF people, and also this American Soros.
I will, Professor
Oh, I
Rene,
see.
I'll
I'm
ask
sorry.
you to wrap it up because we're a bit over
Oh, sorry,
time.
sorry.
So if you could just
Oh,
wrap
I
it up.
forgot. I forgot. Sorry. No, no. So what is? Let me conclude by saying that you see there. I have so many details about the problem with CARES, but I agree with what my colleague said. There's no due diligence. There's no. You see, if SDGs were used as a guidepost, things would have been better. You talk of public-private partnership. Why not public-people partnership? And why not stimulus coming from the people at the grassroots, as recommended by some politicians like Elizabeth Warren of America, and as along the line of articulated Franklin Roosevelt in the 1930s, we should be ADB should be open to new ideas, and this CARES should be transformed into a real caring program for the people. And along that line, let me conclude by saying, you see, the UN Secretary General Antonio Guterres was saying, we have this COVID pandemic, we have this inequality pandemic, you have this debt pandemic, and so what is needed now is a new global contract, social contract, and Asia, I think, in particular, needs a social contract, and hopefully ADB can lead the way. Thank you very much.
Thank you. Thank you, Professor Rene. Sorry to cut you off, and I know that you're feeling very passionately, especially coming from the work with the communities across Metro Manila and beyond, as we're trying to work through the huge gaps that we have in social protection. So, without further ado, I'll just go back to Director Wu Chong for his reflections. I think points that have been made are key on transparency and accountability issues, the macro development question on the aims of the loans. Are you feeling happy about how the loans are shaping out? Did they achieve the objectives which they meant to do so far down the road?
Thank you very much for those two very interesting interventions, and especially Dr. Rene. I could listen to your insights much longer if I had more time, and if you had more time to give it to us. I'm actually not very happy. I'm never happy about about anything, because we can always do more. But I feel that in every interventions we do, there's always something that we can do better. So that's why it's very useful for us to speak to you and others as well, so you can highlight some of the issues that we can do much better in. So just to go through some of the points that are mentioned here, I think we already talked about the monitoring reports, and that's something that, again, I don't think we're doing well enough to be able to disseminate to the right people. And obviously, if you're saying you haven't seen them, we haven't done a proper job of disseminating that to you, especially on the last Dr. Rene. Your interest in to see how the CARES program is going. It's been probably one of the most comprehensively developed program in terms of monitoring and reporting. So if you wish, I can have somebody make an arrangement to send them to you. So I think all the information you're looking for should be there. But if once you get it, if you don't find it, please do let me know. On the external debt finance, that is you raise a very important point, Dr. Khan. The countries do need to use it very, very carefully and effectively. That's why in many of our ADB or other MDBs investment programs, it takes us a bit longer than generally we will take by private sector, because we look at every aspect of it. We make sure that the project is needed, make sure that the design is done properly, and also it's implemented properly. And there are many policies. Some people complain that we have too many policies, but all of the policies are very, very important, including our anti-corruption. And you mentioned about safeguarding, about anti-corruption. We do have a very, very comprehensive anti-corruption and integrity policy, which is strictly followed, and we do have mechanisms to follow up and investigate if necessary. On the SDGs, again, very, very important point. And, we do have, again, reports that summarizes what we're doing in this SDG arena. And again, we can send it to you. But this is something that's very well integrated into our overall program. In fact, our strategy 2030 is all about SDGs. And as I briefly mentioned to you, actually, in fact, I think one of you mentioned about our overall strategy is still poverty reduction. And we do achieve that by promoting prosperity, inclusiveness, resilience, and sustainability. And under those sort of high-level high-level vision, we have the 7 operational priority areas. So first one, I mentioned about addressing remaining poverty. That's health, education, and social protection, jobs and disability inclusion, and all that's part of that program. And universal health coverage and capacity development for health security to prevent future pandemics. The second one is about gender inclusiveness, and again, that's a very, very cross-cutting issue that we ensure that every intervention actually looks after the interest of women and girls. And the third is about climate change, disaster management, and environment. That's very much green area, and that also includes our Healthy Ocean Initiative. Fourth one is about creating livable cities. We're not just anymore building roads and highways or overpasses, but we go into a city and we work with the authorities to make sure that we do what we can to give access to people, the education, health, mobility, electricity, and so on and so forth. The next one is about rural development and food security. We have to make sure that there's enough food in all of the countries that we work with. And then the last two are governance, capacity development, and regional cooperation. So as you can see, all of the elements of SDGs are incorporated into our long-term strategy and implementation process. One very last point I wanted to just mention about our fossil fuels and solutions and how to help the developing countries phase out of fossil fuel. I think you heard from our Chief of Energy, Yong-Ping. We are in the middle of going through the review of the existing energy policy, and we'll see how we can come out of that. But I'm quite optimistic that we will be much more aggressive in terms of pushing or helping the developing countries do less of fossil fuels. And but one challenge is that we have to help developing countries move into this right direction without causing them to, for example, turn off their lights. Countries need electricity, and we have to find a way to do that. And it's like we're trying to change the engine of a car while still driving 50 or 60 miles an hour. So that's the challenge. So we do need to make sure that we take into account the realities of the ground, including the capacity. So thank you very much.
Thank you. Thank you, Director Woo Chung-um. I think it's that time of the discussion where we open ourselves up to a few more questions from the floor. There's just one question. I think it's probably aimed at Director Woo Chung-um as well. The question comes from Germany. Would it not be possible that ADB helps strengthening the monitoring capacity of their country offices, not just looking into the disbursement performance, but also looking in the human dimension of soft loans? So I think that's a regulatory framework question. How is headquarters, regional departments, and resident missions tracking this?
Yeah, so this disbursement, contract awards and disbursement are two of the key metrics that we use to measure the implementation of projects. But as the German colleague mentioned, it's just as means to an end. So we have to have a very comprehensive results framework, which is actually developed by our strategy colleagues in consultation with all of the operations departments, and the monitoring should be done obviously through the country offices because they're on the ground. So we have for the 7 operational areas that I mentioned, we have a very comprehensive monitoring and results framework, which again we can share with whoever is asking the question.
All right. Thank you. Just looking at the time, we have a good, healthy 8 minutes here, and I haven't seen too many questions in the pigeonhole. So I'll probably go towards the panelists. Does anybody want to ask a question or share a thought at this point? Vidya, Nadine, Professor Renel, Dr. Ray, anyone? Or
Yes.
Go ahead.
Yes.
Yeah, my question to our good director is, you see, when you talk about the SDGs and it is aligning policies, You see, SDGs are 17 goals that are interrelated, interlinked with one another. And had the ADB and the borrowing governments uh, made full use of the SDGs as a framework, many problems could have been avoided. So I wonder if ADB is now very conscious of developing SDGs as a guide, because what I see in the care loans is just a one statement that the program submitted by the Philippine government is consistent with the sustainability program of ADB, just like that.
Professor Renel. So an SDG framework. Before you respond, Director I'll take one more. I think Vidya, you wanted to say something?
Just that, two indicators of the effectiveness of the CARES program loan assistance is health sector preparedness and social protection, or keeping poverty at bay. And the CARES program in our country has failed on both counts. And we've also seen that historically the ADB has invested only 0.06% of its investment in the health sector. Most of it has gone into energy or transport and stuff like that. So even if it is an emergency assistance, what kind of action will the ADB take? What kind of action, at least looking back on a badly rolled out program? And this wasn't something surprising, because no oversight is problematic, because most of the schemes that this kind of money was supposed to go into were already existent, and they had issues in the past of access, implementation, reach, etc. What steps can the ADB take to fix these gaps in the nature of projects it has funded, and to see that it keeps to its stated priorities and philosophy?
Thank you, Vidya. Does anybody else have any further questions?
I have a quick question as well for Director Wu Chung. So, you've referenced the Sustainable Development Goals numerous times now in our conversation. But as I mentioned, one of the big Sustainable Development Goals is actually ensuring quality access to healthcare is given to people. How is basically propping up the private sector contributing to achieving this goal? Especially when we've seen that the private sector is again privatizing the profit and socializing the losses. So people are now being refused beds in the current crisis of COVID-19 because they can't afford to pay for a hospital bed. I just want to understand, because you mentioned we are trying to balance the realities on the ground with the sustainable development goals. Now that doesn't, it seems to me that there's actually a complete disconnection between the two. Because if that's the case, then you're not actually assessing the realities on the ground, which are indicating that the system is failing as it is at the moment.
Thank you, Nadine. Before I go to Director Wu Chung Hum, Zakir Bhai, do you have anything to add, or would I let Director Wu Chung respond?
Just one thing is that just one question rather I would like to just have a Mr. Wood on that, whether ADB has any plan to just to initiate or some sort of to join the much discussed the Green New Deal, what we are actually emphasizing, under which that the not only that the climate friendly investment would be expanded in community, but also the issues has been already mentioned, that the access to health facilities and other sort of the issues of the through the public interventions that would be actually focused or not, that what is planning or what is the focus on the NGO in coming days on that particular matter. Thank you very much.
So, Director Wu Chung Hum, a lot of way forward questions. Professor Reneo on using the SDG as a framework. Vidya on how are projects getting selected and why are projects getting selected the way they are, and will that change? Nadine, is ADB only looking at propping up private sector as the solution for it all? And Zakir Bhai, on the overall, is this going to change? And as the new Managing Director General, how do you feel? Are things going to change at the ADB?
I feel so much love. I feel so much love from all of you guys, and I always knew that the CSOs love me. So all the questions are directed to me. So I'm happy to respond. But before doing so, I just realized I was told that the question from Germany came from my former boss, Ursula Schäfer-Poy. So I just want to say hello to her. Good to hear from you. Unfortunately, I cannot see the chat box on my computer. Yeah, these are all very, very rich questions, and it could take me a long time to respond to that. But let me try this. On the question of health sector, I agree, Vijay, you mentioned about ADB putting not that much money relatively compared to others, and now we're back, and this small amount of money that's gone into the health sector was not by chance, it's by design, because 10 years ago plus 15 years ago when we developed earlier strategy 2020, there was a conscious effort or decision from our management and our board for us to be much more focused and do what we're good at, which was infrastructure and a few others, but not so much in health. That didn't mean actually the health is not important to developing countries. And back then we thought that we can actually rely on others to do more of that and for us to focus on something else. But since about 4 or 5 years ago, there has been increased discussion and on this importance of health sector, and we probably can play a more role. And even about 7, 8 years ago, there's famous Hans Rosling, the guy with the statistics and medical doctor. And every country that actually had a huge economic development successes had health, very, very strong health foundation in those countries. So there's very, very resolute thinking on our side to build our internal capacity for us to be able to help developing countries. So a lot of the health professionals actually left ADB about 10 years ago, but now they're coming back. So we are hoping that we can rebuild our capacity so that next time we talk to each other in a few years down the line, that we do have a much larger investment in health in all aspects. On the private-public, we're not saying that we should let private do everything. There has to be a very good balance between public sectors, regulatory work, and the focus on public good, but also the private sector can play a very important role with their knowledge and finance. So public sector does need to keep a very close eye on how private sector is working by instituting proper regulatory framework. I think my time is about, so just make one last point. As we are hoping that we can come out of this pandemic, there's a concern that with the huge amount of money that's being allocated for COVID-19 related work, including the socio-economic impact support that we did last year, 20 billion plus 9 billion for vaccines. We really do not want to sacrifice the future work that we do in terms of green deals and climate change and so forth. So right now we are looking to see how we can actually build back better and not going to business as usual again once we come out of the pandemic. So each of the sectors that from ADB, the energy, transport, education and health and so forth, are looking at what the new normal would look like and what type of investments will be needed. In some sectors, actually, we are benefiting from the pandemic in a weird way because one of the key issues that we're trying to promote in our education sector was promoting more online learning and remote access to learning. And I think this pandemic is pushing us very strongly in that direction. In other sectors like transport, we have to think very carefully to make sure that people, we made a huge strides in terms of promoting public transport, like railways and MRTs and bus rapid systems, where a large number of people travel together. But during this pandemic, we saw some alarming trends backwards, going back to private vehicles. So we have to design investment projects in transport sector so that people will go back not fearing about infections and be able to socially distance. and all the other sectors also, we are looking to see how we can be a much better design, taking into consideration what the future will look like. So again, when we do this work, we are looking forward to gaining wisdom from all of you colleagues in the CSO space as well. Thank you.
Thank you. Thank you, Director Woo Chang-um. I think we're almost at the last leg of the session. I think maybe I'll follow the opening order of the way we started. And if folks can just use a minute and a half as panelists to say some last words. I'll start off with Nadine.
Thanks, Ryan. I just wanted to again reiterate how COVID has exposed the widespread failure that to invest in a strong and universal public system can really make or break those health inequalities we've discussed in the past hour and a half. We're witnessing these failures again in India at the moment. So my question remains, how can we move forward and how can we ensure people have quality access to healthcare for all when the poorest at the moment are going without testing, without treatment because of oversurge capacities in the public system and currently financial burdens such as user fees in the private sector. Says Director Woo Chang-um, there needs to be a balance, but it seems like the balance is more leaning towards a pro-business approach, which is basically anti-poor. So, I guess I just would like to see a more proactive approach from development banks such as the ADB when it comes to project preparation and assessment. And again, coming back to balancing the realities on the ground, which are really important because it just seems that there's that complete disconnection from what the current projects are being financed and what is actually happening on the ground.
Thank you, Nadine. Vidya?
Well, in the light of the COVID carnage that we are witnessing in India, I think the only thing we can say to the ADB is that you have been part of the problem. The loan has been business as usual. It hasn't been really COVID-19 support that has helped communities, that has helped create a good health infrastructure. And the fact that you did not monitor means that you too have blood on your hands. And yes, it's business as usual for the bank, even if it's a pandemic. And we are paying the price.
Scathing remarks, Vidya. Professor Renea?
Yeah, hello. One major lesson from the pandemic is no one is safe unless everyone is safe. No country is safe unless all countries are safe. And so, you see, one criticism that we have about this top-down militaristic lockdown imposed by some governments, like my government, it is unilateral, and then it doesn't have the benefit of the wisdom that can be shared by all sectors. What we need is a whole of society approach, a whole of humanity approach. And so along that line, we hope ADB can build on what the SDG is saying, more partnership with the people, partnership with the people below, partnership with the grassroots. Thank you.
Thank you, Professor Renea, for those wise words. Zakir Bhai?
Thank you, Ryan, and thank you for Dr. Woo Chang. My last point is that we have to focus on the three particular perspectives for the DB and other MDBs. That already my colleagues have mentioned that the business as usual approach, we have to overcome that and be proactive to not only focus on the quantity, I mean in terms of the loan purpose, rather than the quality of the loan utilized in the ground, especially how to engage the whole community and the whole stakeholders in the particular designing the project so that the intended benefits is truly ensured for the citizens as well, and not only engage with the government machinery, but also the other stakeholder must be engaged in the next couple of decades. Otherwise, it would not be SDG targeted, it would be like very much in paper. In terms of the achievement, it would be really not appreciated. And final point is that the ADB should have some sort of commitment to how can just free from the fossil fuel, even because that has also impacts on the clean air, especially on the COVID-19 affected countries. Like Bangladesh, is that Dhaka city is the most polluted, one of the most polluted city. So if those sort of investment is going in unabatedly by the ADBs in the fossil fuel, so that have some sort of adverse impact in coming days in the public health of the people in beyond the existing health partners. So I believe that ADB should be proactively engaged to just come up with the agreement to the proposal, the new Green Deal, and all the MDBs would be the part of that. So these are my last point, and I believe that the business as well in the operation, especially in the banking system, I mean the administrative financial system should be reformed to engage with all stakeholders effectively. Thank you very much.
Thank you, Dr. Wei. Director Wu Chang, last words from you.
Yes, thank you very much again, Rayan, for organizing this. And, the ADB has been around for the last 53, 54 years in Asia and the Pacific. And, we are very, very fortunate to be able to, work with all the countries and development partners. And we must admit that the region has done really, really well. But Rayan's already a question about am I happy? I'm not happy because until everybody in this region are fed properly, and every citizen of this region is not suffering from the COVID-19 related impacts, we cannot be happy. So in this connection, this conversation has been very, very useful to me personally to hear the perspectives of civil society organizations. And obviously, we do have a lot of blind spots where we need to do better. So I would like to encourage everybody to continue this engagement during this week through this virtual way, but also in coming months and years. And I'm very much looking forward to seeing all of you face to face again sooner than later, so that we can share our insights together, so that we can jointly, collectively celebrate the eradication of poverty in this region. Thank you.
Thank you. Thank you, Director Wu Chang. For me, I guess, getting out of the pandemic is the outcome which we're all looking for. We're also trying to look for preparing ourselves for the next pandemic. But these are the objectives. I think if we do not go through the rigorous process of redistribution, redistributing wealth, redistributing services, redistributing access, and the process of doing so. And if we are not mindful of that, then we will not achieve the outcome of being pandemic free and preparing for the next one and reducing our climate risk and vulnerability. So for the organizers, I guess this is the final cue. Maybe everybody can switch on their cameras. And I wish everybody good health. And do stay safe. The pandemic is still here. So wash your hands, wear your masks, and try to get vaccinated as soon as you can. And thank you very much, everyone, for your great insights. We hope to continue the dialogue moving forward. All the best. Bye-bye.
Thank you. Bye-bye.
Thank you.
Bye-bye.